All right, let's go, guys. I am back. I am here for your lecture. We are in Learning Module 2, Week 4. Time is rolling by so fast. So brace yourself, and I promise to be short and sweet. Toggle back and forth between your lecture notes, which are posted on Blackboard, as well as your PowerPoints. Just be mindful, there will be a quiz on these 3 chapters that will be available to you after Saturday of this week, after you take your first exam. All right, let me set my timer. Let's go. Chapter 17. Hip, pelvis, and thigh injuries. All right. So you're going to take your notes and you're going to answer the questions accordingly. All right. So, all right. What kind of joint is a hip joint and why? It is a synovial ball and socket joint. And the reason why, because your hip can make multiple movements, or it does multiple movements. It does abduction, it doss adduction, it does extension, and it does flexion. So that's the reason why it is a synovial ball and socket joint. Okay, what part of the femur is in the cerebellum of the pelvis? And that is the head of the femur. Okay, that you'll see as you see in the document, you see the head of the femur is round, so it can fit into the pocket to allow movement of the hip. And you have your trochanter, which also is in the top portion of the femur. So these are very important bones, and this is a kind of a very crucial setup in terms of hip replacement surgery. So now we're just going to skip right on through. Won't go too much into the anatomy and the bone makeup of it. Just know you just want to get familiar with it being a ball and socket joint and the critical points of the femur of the hip. All right. How many muscles make up hip flexors, hip extensors, hip abductors, and hip adductors? Okay. We're going to start with the flexors and extensors. All right. So you have your rectus femoris, sartorius, and iliopsoas as your hip flexors. All right. Your hip extensors include your hamstrings and your gluteus maximus. Okay. So for hip flexors, it's 3 muscles. For hip extensors, it is 2 muscles. Going on to the hip abductors. Okay. You have your gluteus medius and minimus. Remember, your glutes have 3 groups of muscles in it, and your IT, or your iliotibial band. Okay, that's what makes up your hip abductors. Okay, remember what abductor means, or abduction means. Okay, it means moving the leg away from the center of the body. Okay, now you have your hip Remember what adduction means at bringing the leg back into the midline of the body. Okay, you have your adductor muscles, which is a small group of muscles that are kind of located on the inside of your thigh. You have your gracilis and your pectineus. So those are just important factors of the adductors and the abductors. So yeah, moving right along. Okay. What are the primaries we're protecting in the hip? All right. So we are just protecting the entire thigh and the hip crest. Okay. That bony part that you feel as you kind of maybe put your fingers around your waist, like shortly, maybe about little diagonal, definitely lateral to the belly button, as you want to lateral and lower. Then I'll keep it there, lower than and lateral. You'll start to feel that bony portion, or that kind of that protruding area right in your hip. Okay, that's considered your hip crest. All right, so in proper protection, that's what we are ideally protecting in the athlete. Okay, and of course you want to engage proper flexibility. Okay, making sure that there is movement going on in the hips at all times. Okay, so that is not an area that is an undesirable area to not be as flexible. So it's very important to maintain flexibility in that. ACSM recommends flexibility, or any type of flexibility exercise, for all 7 days. So flexibility is critical, especially if you are one who sits a lot. All right. Now, proper strengthening. It's important for both the hip flexors and the extensors. So, yeah, it's a good idea for everybody, not just the ladies, including myself. I'm guilty, to strengthen our backsides, strengthen our glute muscles. It is important for everybody. Doesn't matter what gender you are. Good strengthening in your glute muscles are good to keep your glutes alive. We kind of put them to rest or we don't activate them enough when we're constantly sitting. So just to make sure that you're involved in certain activities, such as a kettlebell swing, my personal favorite, and doing some lunges to help strengthen those hip flexors and extensors. All right, so what causes a stress fracture? All right, so we're just going to simply go through a few slides. This is just a picture just showing what an avulsion or a pulling away of the bone looks like. We talked about growth plate damage, making sure that your student athlete or your athlete under 18, when they are injured, making sure that we approach the right protocol to be able to ensure that we're not stunting their growth. We'll talk about repetitive stress or stress fractures in a minute. And of course, direct trauma, that's a surefire way to break a bone. So, or to have a bone pull away. We talked about the importance of the padding, as you can see here in this athlete. You want to make sure that you are using pads to kind of protect, not kind of, but definitely protect the iliac crest, the kind of that bony portion that we talked about, because it is actually painful to injure that. And labral tears, you could tell there's a labral tear because range of motion is impacted and generally surgery is needed. But it's not always, mandatory. Let me say it's needed to kind of do a full repair, but it's not always mandatory, meaning that you can essentially be fine with a labral tear, because it doesn't really tear into the joint. All right, we mentioned avulsions, pulling away, and making sure we're protecting our younger athletes. And here we are with stress fracture. What are the causes of stress fractures? These are the causes. Repetitive action, which is mostly in running. Pounding, that causes the femur to bow a little bit with each step. Small little hairline fractures or small cracks as a result. Generally you definitely need rest and you definitely do need to do another exercise. I'm pretty sure some of us may have attempted to do some exercises during the early phases of the pandemic. And we noticed that after running on concrete, because gyms were closed, how painful it was, and either the next day or right after, especially, with constantly doing ground exercises. Okay. That can actually play a role in stress fractures, just constant pounding. So just something to be mindful of in terms of, working out outside, especially on concrete. All right. So, why is a fracture to the femur a medical emergency? Okay. Just imagine something probably as large as, I'm just going to try to give a good example, a semi-good example. Just imagine breaking apart something that is supposed to be as stable and as strong as maybe, let's say, a fire hydrant. That's supposed to be pretty stable and pretty strong. That's just, just kind of using just a general example, rough example of describing the purpose of the femur. It's meant to stabilize, basically weight on our body. And if that is broken, that is a serious emergency, because internal bleeding can occur, and that could damage the nerves and the vessels as well as the tissue. So if there is a femur fracture, then that does warrant immediate medical attention. And of course, talking about the physical therapy aspect of it, so oftentimes, you do have to be casted, and sometimes that does require some PT or some retraining of gait or walking, just to be able to kind of get the body back into maneuvering. So that's the reason why femur fractures are just so serious. So, yeah. Let me see here. Where are we at? What is the other name of your tailbone? That's the next question. But just kind of going lower and deeper into the pelvis. Okay. There can be stress fractures that are placed onto the pelvis, but generally ice is the best method, or prices. And we talked about what prices meant. And it can take a little while to recover. All right. Tailbone is your coccyx, Coccyx. Okay, that is extremely painful to injure that. Oftentimes, you will have to get a physician to examine you, and you may have seen those donut-like pillows where people may sit on for various reasons, and that may require that in terms of to relieve the fracture. So tailbone is considered your coccyx, or your coccyx is considered your tailbone. So you can, like most ball and socket joints, you can dislocate it. You definitely will need to go through physical therapy to go through gait training. Now, this is an important word that we'll probably go back to eventually, but gait means walking. Okay, it is your walking cycle. All right, so we won't go into too deep of details of what gait is. That's more of a motor learning conversation, but just know that gait is identified as a walking pattern. All right, so these are various treatment modalities for your hip, pelvis, and thigh. This specific disease affects younger children, and it can disrupt blood flow. So, definitely, medical attention is needed just for full evaluation to ensure blood flow is occurring for that young athlete. And as we talked about, you want to make sure that you're not providing a modality or treatment modality that hinders growth of the child. So, very important to acknowledge those symptoms if you do have a younger athlete that does exhibit symptoms of leg calprothes disease. Okay. Different muscle and tendon injuries. Okay. You have a strain. And of course, with the help of prices and supporting with various bandage modalities. Contusions, we talked about contusions being bruises. You want to be mindful of deep bruises because there is a lot of bleeding present. So, and going into various other leg and thigh injuries, you have myositis ossification. Okay, ossification generally means calcium buildup. Okay, and of course, our bones are known to hold on to calcium. So it basically is where calcium or bone tissue are built up where there is a bruise. So. You can always wear padding to protect from re-injury. And some good technique to regain range of motion is that it says in the notes gentle strengthening, but I like to incorporate functional training. Functional training is just basically all the activities that you do that are very common to terms of activities of daily living. All right. And we talked about good old bursitis. Back to bursitis. Yep, there's bursa even in the hip. All right, think about your greater trochanter, which is the side or lateral hip, is wide open to be exposed to hip bursitis because we can put a lot of pressure on that part of the hip, whether it's padding is too tight or whether your occupation calls for you to remain in that position for an extended period of time. And just imagine how painful it is. We may not like climbing steps now, but just imagine how painful it is to climb steps with hip bursitis. All right. So just a brief overview. It's very important to get acclimated with the bones and the movement as well as the muscle of the hip. Just something you don't have to memorize in this specific course, but it's ideal to know just to acclimate yourself with the parts of the hips in terms of treatment of injury. So then it's also important to know that certain injuries, such as a femur fracture, are a real medical emergency because there can be internal bleeding, and trying to fix it in terms of on one's own attempt is a no-go because there's probably injury to tissues, blood vessels, or nerves. That's it. See you guys on the next chapter.